Hello, 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 everyone. My name is Sean Crowley, and I'm the owner and founder of Stonehenge Advisor Group. I also am the host and founder of my YouTube channel, Baby Boomers Healthcare Guru Solutions. Hopefully, you've had an opportunity to view some of the videos that I posted on my YouTube channel, on the topics related to Medicare and Social Security. I'll also be posting in the near future on TikTok and Instagram, so stay tuned. Today's topic is the Medicare prescription drug donut hole. It's officially known as the coverage gap. This is a phase in Medicare Part D where beneficiaries may have to pay higher out-of-pocket costs for their prescription drugs. So in 2024, the coverage gap begins once the total drug cost, both what the individual pays and what the plan pays, reach a certain limit. This is set by Medicare. So in 2024, beneficiaries will no longer pay the 5% coinsurance once they qualify for this catastrophic coverage due to a provision of the Inflation Reduction Act. This eliminated the cost-sharing requirement. Now, the standard deductible is increasing from $505 in 2023 to $545 in 2024. So let me explain to you what this is. This is the first phase, okay? So this basically is where you, the individual, okay, if you have generally either a tier 2, 3, or 4 medication, or even a 5 medication, okay, you're going to be 100% responsible for paying for this medication, okay, until the total reaches $545. It's set in 2024. So basically, what that means to you as an individual is you're going to be out of pocket, in phase one until your out of pocket reaches $545. Now, generally, with most of the plans that I'm reviewing from my clients, those medications are usually in the 3, 4, and 5 tier levels, where you're going to be responsible for the medication until you reach a total out of pocket of $545. Then what happens is phase two, the plan co-ops with you on the cost sharing of the medications until you hit this next phase, which we're going to be talking about. And this is the initial coverage limit. And that's increasing from $4,660 to $5,030 in 2024. The out-of-pocket spending threshold is increasing from $7,400 in 2023 to $8,000 in 2024. Now, this is equivalent to $12,447 in total spending in 2024. That's up from $11,206 in 2023. So this brings up my next point, and actually my biggest concern, one of my biggest concerns. Healthcare costs in this country are increasing at a rate of 5.5% a year. So that's the inflation factor that's set for healthcare costs, which includes your prescription drug costs. That does not include long-term care, okay, which is not covered by any of the Medicare programs, okay? So with that being said, we all need to plan for these healthcare costs when we're doing retirement planning. This includes what the beneficiary pays out of pocket, plus what the manufacturer's discount is, okay? This is included in this spending threshold. So to avoid or minimize the impact of the donut hole, individuals should consider the following strategies that I'm going to recommend here today. Number one, choose a plan wisely. Work with a trusted Medicare advisor like myself who can guide you and help you find the right plan, okay, that's going to cover your healthcare costs and your prescription drug costs. In other words, find you a plan that's appropriate for you and meets your goals and your income, okay? You want to look for a Medicare Part D plan that offers coverage during this coverage gap. Some plans provide additional coverage during this phase, reducing the out-of-pocket costs, or reducing your out-of-pocket costs more specifically. You want to use generic drugs whenever possible. Using generic versions of prescribed medications can help reduce costs. And frankly, generic drugs are generally more affordable than brand name drugs. Number 3, utilize patient assistance programs. I myself utilize these programs on a regular basis for clients that I'm working with. Okay, what's great about these programs is some pharmaceutical companies and nonprofit organizations offer assistance programs to help individuals with the cost of prescription medications. In some cases, these programs eliminate the cost altogether. Number 4, so please explore those options, okay? Contact me, and I'm more than happy to help you. Number 4, discuss medication options with your healthcare provider. And talk to your healthcare provider about lower cost alternatives or therapeutic equivalents that may be available. Number 5, explore extra help programs. Extra help is also known as low income subsidy, or LIS. These are programs available for individuals with limited income and resources to pay for their prescription drugs. Number 6, consider state pharmaceutical assistance programs. Some states have programs that provide additional assistance with prescription drug costs for Medicare beneficiaries. Lastly, it is essential to stay informed about changes in the Medicare policies and plans, as well as checking with the specific plan you're enrolled in for details on coverage during the coverage gap. So if you need the most up-to-date information on the 2024 Medicare prescription drug donut hole, I recommend talking to a Medicare advisor like myself, okay, or checking in on the official Medicare website or contacting Medicare directly. Thanks for tuning in. And as always, it is my pleasure. And don't forget to like and subscribe to my YouTube channel. And tune in to TikTok and Instagram for upcoming posts there as well. Thanks a lot for watching, and see you on the other side.